Okay. Hey guys, I know you're all filtering in. This again is the session where your cameras aren't on, but you guys are in. You'll be able to hear Sheila give her presentation. I just need about a minute to get our moderators over as co-hosts. And then we'll be able to get going in just a sec. Okay, so during this session, our moderators, myself and Dr. David, are going to stay with our cameras off. Sheila is going to be the only one presenting currently. When we get to the question and answer session, the moderators can turn their cameras on so that you can see all three of them. Sheila will read out, the moderators will read out any questions to Sheila that you guys ask in the question and answer section of this. Like always, feel free to add those questions into chat or into the Q&A feature in the webinar. And again, our moderators will get that going when we get to the question and answer section. Sheila, I'm going to just turn it over to you and shut my camera off.
All right. Well, thanks everyone again for joining us today and for taking the time. I know that this, I'm at the end of the day, so I really appreciate that so many folks have stuck around, and I hope to provide you with some interesting information. So for those of you who don't know me, I'm Sheila. I've been working with this team for 5 years now, and most of my work has been on the Accelerate research study. And I know all day everybody has been saying, we'd love for you to join Accelerate, join Accelerate, join Accelerate. So I know that we do a great job on our end trying to promote enrolling into Accelerate, but I want to do a better job myself describing to everybody what we actually do with your data in Accelerate and how important and useful it is for us. So I'm hoping to, kind of dismantle the black box that is Accelerate and show you really what we've done over the last few years and what we're hoping to do moving forward. So with that, I'll get started here. All right. Okay, so what is Accelerate? So Accelerate is actually an acronym. It stands for Advancing Castleman Care with an Electronic Longitudinal Registry, E-Repository, and Treatment Effectiveness Research. So Accelerate is what we call a research study registry. It's observational, non-interventional, meaning that we're not asking you to go on any specific drugs. We're not asking you to take any interventions. We're just interested in studying what has happened to you and your disease. And the primary objective of Accelerate is to collect this real-world demographic, clinical, laboratory, patient-reported outcome, and treatment data on patients with Castleman disease. So that's patients with all subtypes of Castleman disease. We're interested in studying you and just understanding what has happened with you, with your course of disease and with your course of treatment. And so how does this actually work? So when you, well, we'll go through this step by step. So it's actually a 2-arm enrollment. And so some of you on this call might actually be involved in what we call our physician-directed arm. So for patients who are in the UK, Italy, France, Germany, Norway, Spain, those patients will enroll through some collaborator physicians that we have. So we have some really great collaborators who will enroll patients in their clinic, and they'll help to get those patients involved in Accelerate. And so if you're in any of those areas and you have questions, feel free to reach out to us. The rest of the patients on the call who are involved in Accelerate, these patients are enrolling through what we call our patient-powered arm. And so we call this patient-powered because it's really you who are powering this research. As you all well know, this is a rare disease. And so for something like Castleman disease, it's really hard for us to find one single center in the US where we can enroll patients through that center because you have physicians all over the place. So it's hard to find sites for you to go to. But what we can do is have you enroll yourselves online, and then we're able to kind of take it into our hands to collect your information. So you're really powering all of this research that we have going on here. And so once you enroll into the registry, you sign a consent form, you fill out some forms. We have Chriswell on our team who actually reaches out to all of your hospitals and institutions. She collects your medical records, excess tissue from prior surgeries, radiologic images. She reaches out to everyone to get that information. So as soon as you enroll into Accelerate, we have people here who start right away working on you. Once Chriswell gets all the information here, we have Russell and Mateo who are on our team here. They actually go through all of the data line by line. They enter that data into our database so that we can understand what's going on with you and your treatments and your clinical course. And we're actually able to pair this data with samples in our biobank. So some of you, I'm sure, have talked with Bridget, who has been helping to enroll patients into our biobank. We use what we call a global unique identifier. So this a GUID. So it's a 12-digit alphanumeric code that's assigned to you and uniquely to you. So if we know that you're enrolled in Accelerate, you'll have this unique 12-digit alphanumeric assigned to you. And if we know you're enrolled in biobank, you'll have that same code assigned to you. And that way we can de-identify all of your information and then pair it and use it together in our research. In doing so, we can make these really high impact discoveries, which we're going to go through a bit today. And we can disseminate all that research, and I'm hoping to do that right now. So I did want to just kind of, put some faces to names. I know you've met all these folks here today. And I just want you to know that as soon as you start enrolling into our study, we really do have people here working right away to get you involved and get all of your information so that we can add you to our study. And so then how does Accelerate actually contribute to the research and everything that we've been doing? Well, of course, it all starts with the CDCN. This is how we've built this network of patients, how patients find out about us. And as I've said, this is a patient-powered study. And then Accelerate, the primary goal, as we talked about, is collecting this real-world data, so clinical data, treatment data. We want to know what's happening with patients. And we have a lot of secondary goals as well. So this is to inventory the types and locations of clinical tissue, to define clinical features and biomarkers, and to identify subgroups, and then also to identify treatments and their effectiveness and safety profile. And we also want to know, survival and quality of life metrics for patients. And so how this has translated so far is that we've been able to study the etiology of disease, and that means the cause of the disease. We're able to do research on the cause of IMCD. We're able to do research on signaling pathways. So we want to know what immune cells are talking to each other so that we can target certain pathways. We're able to research cytokines. I'm sure that's a word that many people have heard a lot more in the last year and a half throughout COVID, but cytokines are really inflammatory proteins, and they're made by immune cells to help regulate the immune system, and we're able to study those as well. We can also study different cell types that might be involved in Castleman disease to better understand how to treat it. We've been studying subgroups of patients. So of course, we have the unicentric, the multicentric, but even deeper down, there appear to be these different subtypes that we're able to study with Accelerate. We're able to look into the treatments used in IMCD and how effective they've been. And we've been able to use Accelerate to identify patients who might be good candidates for our clinical trial for sirolimus. And lastly, we're able to look into the quality of life. So we're doing research on the experience of UCD, which we've heard a lot about from patients, all of you patients at these summits over the last few years. And we're also doing some research on the experience of patients during COVID. So importantly, a lot of these studies wouldn't be possible if we didn't also collect samples from our biobank. And so that's why when we encourage folks to enroll in Accelerate, we also encourage them to enroll in our biobank. And we try to make that as easy as possible for you to enroll in both of these studies. But really, the important thing is that we get your clinical data through Accelerate, we get samples through the biobank, and then we can de-identify everything, use codes to match that information, and include it in our research. And so we've actually been able to publish a number of things, a number of these studies over the last few years, with one more that was submitted and recently very favorably reviewed. So what I want to do today is actually go through each of the published studies just to give you a little bit of information about what we've really done with your data and how being in Accelerate in the biobank has contributed to everything we've done over the last few years. And again, hope to just give you a better understanding of how Accelerate is truly the backbone of what we do here. So I'm going to start with identifying and targeting the PI3 kinase AKT mTOR signaling in IL-6 refractory patients study. So that's quite a mouthful. So what is it? So this was an investigation of tissue, so lymph node tissue and blood samples in 3 patients who were refractory. And that means that they relapsed, they didn't respond well to anti-IL-6 treatment. And that's siltuximab or tocilizumab. And we use different translational methods to identify possible alternative targetable pathways. So we looked at cytokines, those inflammatory proteins. We looked at proteins in the serum of your blood. We did flow cytometry to help to characterize and define different cell populations. And what we learned is that there is increased PI3 kinase AKT mTOR pathway activation. And so this is an intracellular signaling pathway, and it's important in a lot of different cell functioning, and it's been implicated in different autoimmune and malignant disorders. And so what we found is that the administration of a drug called sirolimus, which inhibits mTOR, has induced clinical benefit in these 3 patients who were refractory to anti-IL-6 treatment. And so what was Accelerate's contribution? How does Accelerate figure in here? So the clinical data that we got for these 3 patients and the tissue that we studied was all collected under Accelerate. So we wouldn't have been able to do that research without collecting that tissue there. And so what you're actually seeing, I know this is a small picture, but these are pictures of lymph node slides. And so when you get your lymph node taken out, they essentially put that in wax, and then we can cut off slides and stain it for different things. And what you're seeing here, this top slide is for a reactive lymph node, meaning that this is a lymph node that doesn't look like Castleman disease, but may have some other inflammatory process. And you're also seeing a Castleman disease lymph node, an IMCD lymph node down here. And you can see a lot more of this brown staining, and that's indicating that there's more activation of the mTOR. So we're able to just take that tissue that you have donated to us through Accelerate and do these research studies here. All right, so from that, we did a further investigation of mTOR and Castleman disease. So what was this? Well, as I mentioned, we had found in those 3 patients that pathway was up. And so we did an additional investigation of mTOR in tissue, in blood, and in serum proteomes from IMCD patients and controls. So we stained lymph node tissue again for markers of the mTOR pathway. And we also stimulated cells from blood samples to study the mechanism that might be behind this. And so we learned that mTOR activation was increased in areas of IMCD lymph nodes. And we found increased baseline mTOR pathway activation in blood from IMCD patients compared with controls. And also when we took these cells and stimulated them with IL-6, which we know is a driver in some IMCD patients, and we know that's capable of inducing mTOR activation, we found that there was increased mTOR. So we're finding that mTOR appears to be implicated in some patients here, and it's definitely increased in the lymph node compared to some other diseases and compared to control. So again, from this study, we weren't able to do this study unless we had this tissue and this clinical data, all of which was collected through Accelerate. So, you know, as Chris was collecting your records, as Russell and Mateo were entering that data all gets applied to these different research studies so that we can do these translational studies. So next, we did a multiomics search for activated immune cells and pathways in IMCD. So multiomics is really an approach to analyze data where you're looking at multiple different omes. So when you say omes, you're kind of thinking of the genome, which is all your genetic information, or the proteome, which is your set of proteins, or the transcriptome, which is the set of RNA, and that means the coding portion of your genome there. And so we did a targeted approach to identify immune cell drivers, specifically in IMCD TAFRO patients in this study. And so we did cellular studies studying the cell types involved, and transcriptomic studies studying the protein coding part of the human genome. And so here what we learned that some immune cells were activated and others were altered during this IMCD flare, TAFRO flare. And the changes that we observed were actually associated with a type 1 interferon cell response. And type 1 interferon has been known to play roles in different viral, bacterial, and autoimmune infections. And that's giving us some information that interferon signaling could be a driver in IMCD. And so we're better understanding these potential drivers of the mechanistic drivers of Castleman disease here. And so how did Accelerate contribute to this study where we're learning more about the drivers of IMCD? Well, we got all of the patients that were involved in this study. Again, we got all of their clinical history and their treatment histories through Accelerate. So we're able to better understand these patients that we're studying. So when we get a blood sample in our biobank, we really need that clinical data in the background to understand the different variables and the possible confounding variables. So we got all of that from Accelerate. Okay, and so the next one was SPEED 2, or serum protein quantification in IMCD and related diseases. So what was this? This was a proteomics study, a study where we were measuring over 1,000 proteins in the blood of IMCD and other related diseases. And so we learned that IMCD is really heterogeneous and really diverse. And in this graph, it might be difficult to see here, but so what you're seeing is that each dot represents a patient. The green dots are HHV8 positive, so a subtype of Castleman disease. Blue dots are lymphoma, and purple dots are rheumatoid arthritis and an autoimmune disease. And the red dots are all IMCD. And so you're seeing that these three diseases are all clustering pretty tightly together, whereas IMCD is clustering across the board here, saying the IMCD is really heterogeneous, and we're really trying to better understand these different subtypes within IMCD. We also learned that we can predict the subgroup of patients who are most likely to respond to siltuximab. And looking at those patients, as well as patients who didn't respond, we identified the Janus kinase or JAK inhibitors, which are already approved for treating other diseases, that these drugs might be a promising alternative. So all these studies that we're doing, we're identifying different pathways, different cell types involved, so that we can try to find drugs that might benefit patients who might not be responding to siltuximab or tocilizumab or those other drugs. And so here, again, we got this lymph node tissue, and we were able to study the JAK-STAT pathway through Accelerate. So all of these things that we collect through Accelerate go towards these studies here. And then SPEED 1 is our next study that we looked at. This is actually the predecessor to SPEED 2. So this was a similar study where we're looking in the serum, the plasma here. So we're looking in your blood, essentially looking for proteins that are elevated in flare versus remission. So in IMCD, a lot of patients have a really extreme flare and may have hopefully have a very consistent remission. So we want to look at the differences there. And so what we found in this study is that chemokines, which are different signaling proteins that help to direct your immune cell movement, these were significantly increased in IMCD flare. And specifically CXCL13, which is a chemokine that's essential to lymph node development. And of course, lymph nodes are, an enlarged lymph node is key to Castleman disease. We found that was the most upregulated chemokine. And so here again, we were able to study CXCL13 through the data and the tissue collected through Accelerate. All right, last couple here. So, I've talked a lot about the studies that we've done with MCD, but we've also been doing studies with UCD as well. So we were able to look at the UCD diagnostic and treatment guidelines. So this was guidelines for the diagnosis and treatment of UCD developed by an international expert consortium that the CDCN convened. And so we learned that the preferred therapy for UCD is a complete surgical resection. Unresectable asymptomatic UCD can be observed, but symptomatic UCD might require additional treatments such as rituximab and steroids or anti-IL-6 therapy. And so Accelerate's contribution to this study was that we were able to look back into Accelerate, look at our UCD patients and see how well that those patients responded to surgical excision. And we were able to find that there was a high response rate to surgical excision, so helping to inform these guidelines that we created. And then the last study that I'll talk about that was submitted and that we recently got very good feedback on is about cell types in bone marrow. So this was actually a characterization of bone marrow, and bone marrow produces different cells like white blood cells, red blood cells, and platelets. And we looked in the bone marrow of patients with IMCD. And so we actually learned that there were certain features present in IMCD bone marrow. And these features are hypercellularity. So that's an increased production of one of these different cell types. Megakaryocytic hyperplasia. So that's increased megakaryocytes. Megakaryocytes are actually what create these platelets. Platelets are formed from megakaryocytes. And we know that platelets are often either very, very low or often very high in Castleman disease. So we know there's some disruption there. And also in reticulin fibrosis. And that actually indicates buildup of scar tissue and can prevent proper production of blood cells. And so these features together might support a diagnosis of IMCD. So, of course, IMCD right now is diagnosed based on your histopathology of your lymph node. It's based on your clinical features and your lab values, on excluding other things, but it's still difficult to diagnose. So anything that we can do to help support the diagnosis of Castleman disease, we're trying to look into. And so here, I talked a lot about having collected lymph node tissue. We're actually able to also collect excess bone marrow tissue from prior procedures that you've done through Accelerate. And we were able to study all that and look at all of your clinical data. So this came really right from Accelerate. And so, of course, as I mentioned before, there's a lot of other studies that we're working on right now, trying to understand the cause of Castleman disease, better understanding the cytokines, the subtypes, treatments in IMCD, the sirolimus trial, and experience of patients with Castleman disease. And so if you'll just indulge me for a few more minutes, I just want to give you some information about some of these upcoming studies that we have. So we've been talking about this for a while now. We're looking into the spectrum of disease with Castleman disease. So, we talk about unicentric and multicentric. And as you join our studies, we will ask you, do you have unicentric disease, or do you know if you have multicentric disease, of what subtype? But we've really found that it can be very difficult sometimes to assess subtypes of patients. So we know that there are some patients who really do have a true unicentric disease. Their lymph node gets excised and they have a great response. And they're on this end of the spectrum here. Some patients, particularly thinking about our TAFRO patients who they have extensive lymphadenopathy, really severe clinical course, maybe in the ICU, very severe. But we also have patients in between where they might have a few enlarged lymph nodes, and they do have some, inflammatory syndrome or some symptoms happening. And we also have patients, again, who have really extensive lymphadenopathy, but they might demonstrate very different clinical symptoms than those TAFRO patients do. So we're really trying to understand all of these different subtypes within Castleman disease. And so what we did is we reviewed radiological images from over 130 patients who were enrolled in Accelerate. So when you enroll, we're able to go out, collect those images from prior studies that have been done on you, prior radiological studies. We can review those and understand the lymphadenopathy happening in your body. And we pair those results with clinical and lab findings collected in Accelerate. The next study I wanted to briefly mention that we're still working on is our UCD experience study. So this really has come about in large part due to these summits. So we've been listening to you all throughout the years, and we've heard that patients say, like, I know that my lymph node was removed and my physician says I, am quote unquote cured, but I'm still having symptoms. What do I do about that? And so we've really been listening to that. And so the context here is that complete excision of UCD lymph node is reported to be curative in most cases, and it is what we recommend, an excision of a UCD lymph node. But we've had some data suggest that some of our patients are still describing the persistence of symptoms such as fatigue or just lower quality of life after a lymph node excision, despite having normal lab values and despite absence of lymphadenopathy. So what we did is we sent surveys to UCD patients to capture information about general quality of life, about specific health measures, and about ongoing UCD symptoms, so we can better characterize and describe UCD. And so far, our data are suggesting that UCD patients who have had a lymph node excision continue to experience symptoms that have affected their quality of life. And these patients reported health measures comparable to a cohort of individuals individuals with chronic health conditions. So, thinking of individuals with diabetes or a cardiovascular heart disease or these chronic conditions that we classically think about, patients with UCD are reporting that they have health measures that are similar to these patients who have these chronic conditions that we know about. And so this is just a study to really better understand the experience of UCD, because we've been hearing for years that patients still feel as if they're experiencing some symptoms. So if you're on this call and you're a UCD patient, you haven't done this research survey, if you'd like to participate, or if you don't think you've been invited to participate, definitely reach out to us. And the last thing, and I know this is of course very important to people given the cloud we've been under for the last year and a half, we've really been doing some research into Castleman patients and their experience during the COVID-19 pandemic. So a lot of Castleman patients are immunosuppressed, in large part due to the medications that they're on. And we know that the most severe patients experience what we call a cytokine storm. So those inflammatory proteins really getting hyperactivated and overacting the immune system. We also know that SARS-CoV-2 infection progresses to a cytokine storm in the most severe COVID-19 cases. So I'm sure at least some of you have heard, cytokine storm and COVID over the last year or so. So we wanted to send surveys to Accelerate patients to characterize their experience with COVID-19 disease and vaccination, to better understand if COVID is affecting Castleman patients to a worse degree, or if the vaccine is, if there's any information about effects with vaccines. And so we sent out a survey to 298 people. 101 patients participated in the survey. So of those, there were 69 people who had reported having been tested for COVID-19. And of the 69, 10 of them had tested positive. And so that's 14.5%. And just for some context, the positive rate in the US is about 10%. And of those, 2 people reported asymptomatic COVID, 7 reported having a mild case, and 1 reported a moderate case. And so also we looked at the vaccination of patients. So of these 101 people who filled out our survey, 87 of them had received at least 1 vaccine dose. And 51 people reported mild side effects, but importantly, 0 people reported any hospitalizations or any severe side effects. And so we think this is a really important signal noting to us that we haven't observed any markedly increased inflammatory response to SARS-CoV-2, and vaccination has been well tolerated. Of course, it's a very frightening thing to have to make a decision of what to do, but our data is really suggesting that patients have done well with the vaccine in terms of side effects, and that so far we haven't seen anything to suggest a much worse inflammatory response to COVID-19 as well. And so you might ask, are there any other studies planned, or everything that I've talked about, is that it for Accelerate? I'm sure many people on this call actually participated in our AIM movement this year, where you're helping to identify research questions for us. And there are multiple people on our team, myself, Mileva, Anya, Amber, David, many people went through all of those questions submitted one by one. So we really took a long and hard look at those and how we can best study each of those questions. And so what we've been able to do are identify some new research questions that we can ask. So we can look into diagnosis. So we can search for a disease classifier to, again, help improve diagnosis. We want to look in the blood morphologic findings of IMCD. We can look more at subgroups. So we want to characterize the POEMS-associated MCD. We want to characterize Castleman disease in pediatric cases, which we know is very important. We want to report the experience of patients who have pregnancy with Castleman disease. We can also look at progression. We're planning on looking at renal disorders in Castleman disease. So that's disorders of the kidney. We want to look at the characterizing relapse and refractory cases of Castleman disease. So patients who have a subsequent flare. We want to look at the safety and adverse event profile of all of our treatments. And we also want to look at the safety and effectiveness of anti-IL-6 therapies. So siltuximab and tocilizumab, there of course are clinical trials on those drugs, but we want to take our Accelerate data and look at that as well. And then we want to describe the comorbidities associated with IMCD, because we know a lot of people have described different comorbidities that they have, as well as the quality of life with living with Castleman disease. So essentially the answer to the question, are there any other studies planned, is yes. We have a lot of studies planned. And so lastly, how can you further contribute? And of course I say further because everything that I've talked about today truly would not be possible without all of our patients rolling in these studies and again, powering our research. Well, if you haven't already, and if we haven't asked enough times today, you can enroll and accelerate. And one thing I wanted to note is that there are 849 people who had registered for Accelerate. Of those, 513 signed our consent form to officially participate, and 444 completed the enrollment forms, which is really great. We're very excited about that. But there's about 400 people between that 849 and 444 who might be able to fill out the rest of those forms and contribute to this research. You can also enroll in Castleman, our biobank. So again, as I talked about, a lot of these studies wouldn't be possible without samples that we collect in our biobank, and we compare those in a de-identified fashion. You can complete your 3 monthly surveys. So in Accelerate, surveys go out every 3 months asking about the quality of life. And those are helpful for us to be able to understand how you're doing. You can tell us if you ever have any other lymph node excision or a flare, if you're experiencing a disease flare where your labs are getting out of control or you're feeling unwell, and especially if you're going to get a lymph node excised, reach out to us and we will work with you to make sure that you feel comfortable in the treatment and have physicians you're able to talk with, but B, so that we can also study some of that excess tissue or excess samples so that we can help to better understand Castleman disease. Tell us when you're going off therapy or starting a new therapy. We might reach out and say, hey, can we get a blood sample from you so we can better understand how that's affecting your disease. And tell us if ciltuximab or tocilizumab didn't work for you. So Tracy runs our clinical trial for sirolimus here, and it's really helpful for her if you reach out and say, hey, I was on ciltuximab, I was on tocilizumab, they took me off of it because it didn't work for me. You could be a candidate for our clinical trial, so definitely reach out to us. And then of course, if you want any information about any of our research, any of our studies, if there's something that you don't understand, can't find, you're welcome to just email any of us, and we're happy to send you some more information. And lastly, how would you even go about doing this? Well, this is the website, cdcn.org/patients-love-1/join-the-registry. If you go there, you can enroll in the registry. You'll see these 3 big buttons. This blue button here, if you click on that, it'll take you straight to the enrollment form for Accelerate. This purple button, this will take you just to the login platform in case you want to fill in your surveys or something like that. And this green button will give you a little bit more information about the study. And of course, throughout this presentation, I've included our emails for Accelerate and Castleman, and you can email us at any point in time. Chris will and Bridget will get back to you as quickly as possible. And I think with that, we're soon to be heading onto a closing session, but I'm happy to answer any questions if there are any that have come up.
Thank you, Sheila. Yeah, we do have a few questions, starting with, are there studies about how mRNA technology may help Castleman patients, or is this premature because we don't know what triggers Castleman disease yet?
We don't have any studies on how mRNA, I assume you're talking about the way that the mRNA vaccines have been developed for COVID. So we don't have anything exactly like that, but we're working to understand the etiology of the disease. Since what we know about, at least about IMCD, is that we don't think at this point that it's caused by a virus. So that exact type of technology where you're creating a vaccine based on mRNA isn't quite as applicable. Yeah.
Okay. We also have a couple questions about donating from Europe. So could you describe a bit about the Accelerate and Biobank processes for European patients?
Sure. So for European patients, if you're located in the UK, if you're in France, Germany, Spain, Italy, or Norway, so we have sites in those countries where for Accelerate, you would enroll through those sites. So you would, and we're happy to send contact information for those physicians. But for example, if you're in the UK, you would want to reach out to Dr. Streetley. He would help to enroll you into Accelerate. So it is a little bit of a different process in terms of the enrollment into Accelerate there. but we can help connect you with the folks in those countries. So that is helpful. In terms of donating a sample, it's a little bit, it can be a little bit harder donating samples from other countries, in part due to the shipment process, in part because of some things are a little bit more complicated because of COVID right now in terms of sending samples back and forth. What we can do is reach out to us, reach out to Bridget actually about your specific scenario. We can work with your doctor who might be willing to draw and process samples for us and send those to us. And we can also collect saliva from you. We might be able to get saliva and you can send that to us. So there are workarounds that we have. It's slightly trickier, but we're always happy to try to help.
And Sheila, I was just going to chime in and add, first off, awesome presentation. I love seeing all that we've been able to do from all this Accelerate data that so many patients contributed. But yeah, I was just going to mention that things are changing a bit with the European part of Accelerate. So as Sheila's totally right, there are certain doctors that if you want to get into Accelerate, you actually have to go to see if you live in France or the UK, for example. But some of those things are likely changing in the next 3 to 6 months. And so we may be in a position where you can actually enroll yourself directly, even if you do live in Italy or France or the UK or Spain, but or Norway. So we're still working on that. But just as Sheila said, we would love to work with you to figure out a way that a blood sample could be sent. I saw in another meeting or in another one of the chats around family members of IMCD patients were eager to get your blood samples as well. So trust me, if you reach out to us, we'll tell you all the different ways that you can provide, contribute to this fight, and we'll work with you to make it as easy as possible.
Thanks, David and Sheila. Yeah, feel free to reach out to me. I think my email is in the chat. I also have a cell phone too. Another question. So Accelerate asks about your symptoms. How can you tell if symptoms are from Castleman's or from some other illness?
That's a great question. And so the important thing that we're doing is we're really trying to collect all of that information. So we're collecting the symptoms that you have, but we're also collecting information about the comorbidities that you have. And so we're trying to take all that information together. And that's where, one, when we have enough people in the studies, if we have enough people with enough, it's really a numbers game and a powers game. So we want to have the power to say, okay, we're seeing this symptom in all of these patients. There may be a signal there, but then we also can look at your comorbidities and we can look at those as what we call confounders. So those might be something that is confounding, or maybe that is actually the reason that some of these symptoms are happening. So we can control for those things. So we're looking at, so we collect all of that data so that we can do that.
Great. We have a couple more. So if someone donated originally back when they were diagnosed, should they send updated samples?
So I think the important thing is always reach out to us and we're happy to help figure out A, if you've donated it to us in the past, and B, if it makes sense for you to donate it again if you're willing to. We're always really interested in getting samples from patients who know they're going to be either going off therapy, starting a new therapy. What's really helpful for us is getting samples from patients. All samples are helpful to us, but really helpful samples are those when patients aren't on any therapy. We call this treatment naive samples. So we can get those samples from you. Those are helpful. So if you're going to go off therapy, that's really important for us. If you're going to start a new therapy, we might want to track you on that therapy by getting new samples. And of course, every sample donation, everything here is voluntary. So we're never committing you to anything. But if you're willing to donate a sample, just reach out and we're happy to help you make that work.
Great, thank you. Yeah, when in doubt, reach out. Didn't mean for that to rhyme. Anyways, last question. I'm not sure quite the context to this, but is it too late to submit items if I've already had the tumor in my omentum removed? So I'm not sure if they're referring to tissue or blood.
Yeah, it sounds like they're maybe referring to a tissue that was removed. So there's kind of two answers to that. So on the one hand, when you enroll into Accelerate, what we do is we collect your medical records, but we also collect excess tissue from prior lymph node excisions. So if you've had a lymph node excision in the past, which probably most of you have since you were diagnosed with Castleman disease, we're going to call your hospital and say, hey, can we have some slides from that lymph node that was excised 3 years ago if you guys don't need that for clinical care, we'd love to use that for research. So we're always interested in getting that tissue, and that's tissue that we can kind of get even if the procedure had been done in the past. We're also doing a lot of research lately on what we call fresh lymph node tissue. And for that, it's really helpful for us to know. That's why I tried stressing here where if you're having some kind of disease flare, which we don't want you to have, but if that happens, and if you're going to have some tissue removed, some lymph node tissue removed, reach out to us. And what Bridget does is she works with your doctor to say, hey, okay, we would love to get some of that excess tissue from that excision that they're going to have. So if there's going to be a new excision, of course, everything that should be taken for clinical care, take for clinical care. If there's anything left that might be able to be used for research, we'd love to use that for our research so we can better understand Castleman disease. So on the one hand, it's never too late to enroll in any of our studies because there's always something that's going to be helpful. On the other hand, if you're going to have a lymph node taken out, let us know as soon as possible because that is something that's somewhat time sensitive for us.
Yes, thank you, Sheila. All right, that's all of our questions. Just so you know, for those of you who we didn't answer questions out loud, we did in the Q&A answered section. So if you didn't see your answer, feel free to check there.
Thanks so much,
All right,
Sheila. That was awesome. And thanks, Bridget, for moderating. Like I mentioned earlier, it's just so exciting to see the impact that Accelerate has had. Sheila has been with the team for all 5 years that Accelerate has been open. And she'll remember that back when we were first enrolling patients back in 2016, we knew Accelerate would be important. We knew it would be important for understanding what drugs seemed to be working and not working, but we had no idea just how important it would be. We thought maybe a couple insights would, well, maybe not a couple, we hoped a few insights would come from. We certainly didn't realize that like dozens of really important insights would come from Accelerate. So thanks to everyone who's a part of this and who's enrolled and donated your records. So Mileva, what'd you think? What a good first day, huh?
It was awesome. I'm already getting texts and emails from everybody saying that they just learned so much. And I hate the fact that we still have to do it over Zoom, but I will say I also love it because we have people who are calling in from Germany and Australia and the United Kingdom. And it's just so great to have people from everywhere come. So I'm so happy you guys all got to be here. And I'm so excited that we still have a whole entire day tomorrow and lots of awesome information to continue and more story sharing and just really being able to be together, which is great.
Yeah, I think so too. I thought that the questions, the comments, the small groups were just awesome. I love seeing a lot of people that I haven't seen before. I also love seeing the people I have seen before too, but it's really nice to see that we've got such a strong community. And in our small group, Allison Padden was talking about just how special this community is and how if you post something in the Facebook group, you're gonna get 17 comments within like an hour from people providing support, experiences. This is just a really, really special community. I feel so fortunate to be a part of it. And today I think that's shown through really well. I also loved that some of our new team members like Chriswell and Bridget who are on, Mike, Melanie, Mateo, Russell, Hemi, I'm going to leave people out, but there's a number of new team members that they could be a part of this. And for us to get the chance to see all of you, it really means a lot to our team members to be able to see the people who benefit from the hard work that they do day in and day out. So it's awesome to see everyone together. Mileva, what are you most looking forward to tomorrow?
Wow. I love that you always put me on the spot. I think tomorrow, like today, I've always looked at it as it's like really disease focused and content heavy on especially for our new patients who are wanting to know like, what the heck is this that I have? So I always love today because I really think we learn so much from our experts. Tomorrow I think is awesome because you guys will just really get to learn about like the CDCN and how you guys can be a part of this, what you can do to help be a part of the fight. Different programs that we're doing, how we've progressed over the years. And I know that I've already gotten several texts. I know a lot of them are looking forward to the session where you're going to lead on Castleman and COVID. It's still such a super prevalent topic right now. It's ever changing. Our patients, some are vaccinated, some are waiting to get vaccinated. And it's going to be a really great session where we can continue to kind of just keep everybody as much in the know as we can with what we know. And then I just think overall, I just love being on. So I'm just
Yeah.
excited to continue to talk to everybody. So that will be great.
Me too. I found that throughout the sessions today, there were a lot of questions about COVID, and which is totally understandable. This has, changed all of our worlds. And so, yeah, I think it'll be great to have dedicated time just around Castleman's and COVID. I'll have a great co-moderator, Aaron Goodman at UCSD. He's just terrific. And so I'm really looking forward to that session, but I probably shouldn't pick my session as the thing that I'm looking forward to the most. Although, like I said, with Aaron, it's going to be a great session. But I also I love being able to share our impact. Sheila just really, got across a lot of impact during this Accelerate session, but we'll get in a little bit more, just some more about kind of the impact CDCN has even beyond research studies. So that'll be a great session that you and I will do, Maleva. But my favorite every year is when we announce our Castleman Warrior of the Year awards. And so you all have spoken, the community has spoken and voted. The patient of the year and the loved one of the year award winners have been selected, and I'm hoping that you call in tomorrow and that you're here to accept the award if you were nominated. But we will share with everyone afterwards who the different folks were that were nominated. But I think that the two winners really have contributed so much. So it'll be fun to reveal the winners tomorrow.
And you all have an opportunity to be a winner tomorrow if you post your Warrior Flex photos or send them in. I have got some pretty awesome ones. I am going to force my child, who is almost 10 going on 17, to do one as well. Not that I want her to win. I'm just saying, like, she will also be participating. Last year, David, I think Amelia participated. So I think that maybe she should also throw a photo in there. But all of you have a chance to post those photos, be a part of the competition. It's just a fun way to connect and do this.
Maleva, what's the hashtag they need to put on social media for it to get registered? Will you put it into the chat?
Yep.
Yeah, so take that picture doing the Warrior Flex, post it on social media, put the hashtag in there, and then we're going to pick the winners. Last year, it was so hard to pick, but yes.
It was.
So put them on social media. Let's get Dave Bagley says that he forgets the stance, but I think he's just joking. But I'm going to show it anyway. It's like,
yes.
No, yeah, we need it.
And so it's like in your face too. Sheila knows it's not just a flex. It's like it's
attitude.
In your face too. So do it with your family. The more creative, the more likely you're going to be selected as the winner of the Castleman Warrior Flex of the year. So get those posted online, and really look forward to seeing you guys all tomorrow morning.
Sounds great.
All right. Thanks, everyone.
Bye,
thanks,
guys.
Maleva. Thanks, team.
Actually, real quick, I'm sorry, I'm going to end it. Do not forget, you'll get your email tonight. So I will send another email tonight with reminders about tomorrow, and tomorrow morning around 9 o'clock again, you'll get your email that has all of the links for tomorrow. So do not panic if you click a link from today and it doesn't work. You'll get fresh links tomorrow morning for all of the sessions. And now, bye.